All right, it's a minute after, so why don't we begin? Good morning, my name is Betsy Zorio. I'm the Vice President for US Programs at Save the Children, and I'm so pleased to be with you all today. It's really an honor for Save the Children to be co-hosting the 2022 Rural Child Hunger Summit. And it's an honor for me to be speaking with all of you, the people who are working so hard every single day to ensure that children in rural America are not going hungry. We owe you all a huge debt of gratitude. And when we think back to the last 2 years, we all know they've been really challenging, but it's been also incredibly inspiring to see the innovations and the dedication that has taken place. We're just incredibly honored to be working alongside all of you in the quest to end child hunger. So as you may know, Save the Children's roots in rural America run deep. We got our start in the United States in 1932 when we started a hot lunch program for children in Harlan County, Kentucky in the midst of the Great Depression. And the impact of the program was immediate. Undernourished children were better fed, grades rose, and school attendance increased. Our efforts became the model for the federal hot lunch program. 1 decade later, children in more than 70,000 schools across the country were served publicly funded hot lunches. So from those earliest days working in Appalachia to today, 90 years later, we remain committed to rural America, to partnering with rural communities to ensure that children have a healthy, strong foundation to thrive as learners and in life. And prior to the pandemic, Save the Children's work in the nutrition space was limited. Our focus really had been historically on education. But in March 2020, as schools across the country closed, we knew we had to act. We also knew we couldn't go it alone. Child hunger, as you all know so well, is worse in rural America. 90% of counties with the highest rates of child food insecurity are rural. That's a staggering number, 90%. No one organization can end this crisis alone. It's going to take partners at the local, state, regional, and national levels. It's going to take teamwork. And that's why we're all here today. Our partnership with Sara Streich's No Kid Hungry is a particularly important partnership for Save the Children. Our two organizations have known each other for many, many years, but it was the pandemic that really spurred this partnership. As I mentioned before, Save the Children's work in this space was limited. Our expertise in this space was limited prior to the pandemic. We made what may have been the quickest decision in my time here to enter the child hunger space, and we reached out to one of the leading experts, Sara Bleich, to talk about how we could work together. We knew that we needed to call attention to the crisis that was unfolding before us, as 30 million children no longer had access to breakfast, lunch, and even dinners that their schools provided. So with the help of Save the Children trustee Jennifer Garner and fellow actor Amy Adams, we launched Save with Stories, a campaign that took place across Instagram and Facebook. And as you may recall, we had more than 275 actors, musicians, athletes, and more read stories and call on their followers to donate to Save with Stories. Save the Children and No Kid Hungry raised millions of dollars as a result of that campaign and delivered more than 20 million meals for kids. And we've been inseparable ever since. Save the Children and the Sara Bleich staff have met with White House and congressional leaders to discuss child nutrition reauthorization priorities. We have aligned on our fiscal year 2022 appropriations requests. We've partnered on a rural learnings case study, conducting focus groups with organizations that supported rural communities during the height of the pandemic. And we're co-hosting this incredible gathering that is happening now. So we have some great sessions lined up for you today that focus on best practices, the latest research, promising policy solutions, and innovative ideas. We're incredibly excited to learn from an esteemed roster of speakers who will share their insights, expertise, and experiences with us. Today's agenda includes a discussion on how to overcome the transportation challenges and barriers to deliver nutritious food in rural communities, as well as a session on navigating supply chain disruptions and how we can find innovative solutions during this challenging time. Before we get to our first session of the day, I've been asked to share some important housekeeping information. Next slide, please. The entire summit is being recorded. All recordings, slide decks, and materials that our panelists mentioned today will be shared via email and posted on the No Kid Hungry Center for Best Practices website following the event. We also are asking for you to use Twitter, Instagram, and Facebook, tag rural hunger, hashtag rural hunger, and tag No Kid Hungry and Save the Children in your posts. Share key takeaways, and our social media teams will be on the lookout to comment and share. Next slide, please. Oh, I think we went the wrong way. Okay. English closed captioning and Spanish interpretation services are available again today. You'll see the instructions before you for accessing closed captioning. And on the next slide is information on accessing interpretation. I think that's it for housekeeping. Now I'm excited to get day 2 of the summit underway. Our first session today is an armchair conversation between Dr. Veronica Womack, Dr. Sara Bleich, and Pamela Taylor. They will be discussing equity in child nutrition, especially as it applies to the Black Belt region. There will be no chat box or audience Q&A during this session. The chat and Q&A features will be available today starting at 11:30 a.m. We hope that you come away from today's session equipped with some new resources and feeling inspired to continue doing the hard work you do every day to fight child hunger in rural America. Thanks so much for joining us.
Great. Well, Betsy, thank you so much. We are thrilled to get this day started. I am Pamela Taylor, Senior Vice President and Chief Communications and Marketing Officer for Share Our Strength, the organization behind the No Kid Hungry campaign. And I want to just give a shout out to Betsy and Save the Children. We are delighted to have this partnership with you, be able to put this incredible event on together, and look forward to continuing to working together into the future. Today, I am thrilled to have 2 incredibly talented and deep intellects with us to have this conversation. I'd like to introduce Sara Bleich, who is Director of Nutrition Security and Health Equity at the Food Nutrition Services at USDA, and as well as Dr. Veronica Womack, Executive Director of the Rural Studies Institute at Georgia College and State University, Professor of Political Science and Public Administration. Ladies, welcome.
Thank you. Great to be here.
Thank you very much.
So let's get right into it. For folks who'd like to read the bios, they are on the website that Betsy shared with us just a couple of minutes ago. We want to use every single moment we have today for this rich discussion and conversation. So let me begin with a question for each of you, beginning with Sara. Why did you get involved in this area of work? And why is addressing childhood hunger so important to you?
Thank you, Pamela, and good morning, everyone. It is great to be with you all today. To be totally honest, I want to start off by saying that the topic of child hunger for me is personal. When I was little, I have a twin sister and an older brother, and we directly benefited from federal nutrition assistance. So we participated in SNAP, then it was food stamps. We participated in WIC and school meals. And so I know firsthand the importance of these programs as a young child. And then professionally, I've been focused on the federal nutrition safety net and thinking about ways to tackle diet-related diseases and disparities for close to 20 years. I had the privilege of serving as a White House fellow during the Obama administration and totally fell in love with public service, particularly the mission of USDA. So now it's really an honor to serve in the Biden-Harris administration and get to work directly on the policies and programs that intersect with 1 in 4 Americans each day. And I think that's one of the things that a lot of people don't totally understand is the breadth and reach of the nutrition assistance programs at USDA. They touch 1 in 4 Americans each day. Now, when I was at Harvard, which was my post before joining the administration, colleagues of mine published a paper that looked at the predicted probability that today's 3-year-olds, through their obesity trajectory. And what it showed is that 2 key take-home points. The first is that 57% of today's 2-year-olds would have obesity at the age of 35, 57%. The second is that 2/3 of today's 2-year-olds who are Black or Latinx are expected to have obesity by the age of 35. And that's compared to half of white 2-year-olds. So childhood obesity is a problem, but so too are enormous disparities around childhood obesity. The other thing that just came out today is the Census Pulse data, which looks at food insufficiency. So that's households that sometimes or often have not had enough to eat in the last 7 days. And what it found is that while food insufficiency was reported for 1 in 13 white adults, it was reported for 1 in 5 Latin adults and 1 in 5 Black adults. And many of those households have children. So what we are grappling with now are huge issues around disparities when it comes to both hunger and food insecurity, but also diet-related diseases. And what COVID-19 really made clear is that there is a vital need for access to healthy food, particularly among our nation's children who rely heavily on healthy meals that are served at schools across the country, at childcare centers, after-school centers, and lots of other places. In fact, there was one study which estimated that nearly 2/3 of COVID-19 hospitalizations in the US are related to 4 diet-related conditions: obesity, diabetes, hypertension, and heart failure. And increasingly, these are diseases that are affecting children, and they are associated with decades of structural limitations to retail food outlets that sell healthier foods. They're also, if we're being frank, they're also rooted in longstanding historical inequities like structural racism. So the last thing I want to say as we sort of kick off this session is one area that I'm really focused on now is promoting and elevating nutrition security. And it's particularly important among children because that's going to be invaluable for helping them to establish lifelong healthy eating habits.
Thank you, Sarah. Listening to the statistics, and we hear numbers in our space all the time, and they're staggering and they're alarming, but they're also so very telling about the disparities in our country. And it was really, really exacerbated during the height of the pandemic. I won't say when the pandemic happened because we're still in it, y'all. Hang with us. But it's just listening to the full wraparound that you just shared with us just reinforces the work that we are all doing. This conversation we're having today is so critically important to being able to figure out how do we solve for this so that we can make sure children that are 2 years old today aren't facing obesity and the health-related issues that come with that, in their early adult years. There's so much for us to do. So with that, I want to ask Veronica the exact same question. Tell us a little bit about how you got involved in this work and why addressing childhood hunger is so important for you.
Thank you so much, Pamela, and good morning, everyone. I'm so excited about this opportunity. The work for me is, it's more than just work. It's my life, it's my ancestral heritage, it's my calling and my passion. So I grew up in the Black Belt of Alabama, and I was surrounded by these community experts. They loved the land. They had very traditional foodways. It was a wonderful, loving community where people really engaged each other and really supported each other. Family was huge. And so I went off into the world with this look and understanding of the Black Belt region. And then I entered the academy. And I found that there was a different understanding of my community. And it was driven by negative data, right? It was driven by census data. It was driven by data that did not provide context. And so I recognized the assets of the Black Belt community and felt that I could fill a void in being able to provide context to the social scientists that often study us. And so I know that that was not the whole story of the Black Belt, and that there were many, many systems involved in creating the region in which I grew up. And so I got into this work very early as a college student in providing context and narrative to a region that's often not at the table when we make decisions, right? And so it's very, very important when we think about rural communities and rural children. We often speak to Appalachia, we often speak to the Midwest, not so much the South, and particularly not the Black Belt South. And so it's very important for me in my work to make sure that this voice is at the table, but more importantly, that people understand the region and how the region was developed and created. Unfortunately, childhood hunger is a part of the narrative and story of the Black Belt region. And so addressing childhood hunger for me is very important because childhood hunger robs children of their innocence, of the opportunity to just be children.
Yeah.
And when a child is hungry, as we know, it's of no fault of their own. It's a societal issue, and one that all of us are responsible for addressing. It manifests itself in so many ways through the lives of children, in terms of learning, in terms of education issues, workforce issues, if you want to look at things from the perspective of workforce development and moving economic development of a particular region forward. So what does the future hold for communities where the children are not only impoverished, but hungry? And so that is the work that I do, and my focus of making sure that people recognize the totality of the circumstances of the Black Belt region, the quality of life issues that we're still grappling with. Childhood hunger also follows children when they take their assessments at school, right? There's no box that says, I showed up to take this test and I'm hungry. So factor that into my score. It follows them into the ACT, SAT. So I'm working at a university. There's often a drive in higher ed to look at assessment, to look at test scores as the gateway to people's future, and hunger is there in that data. And so it's very important for me in the work that I do to make sure that the narrative about the Black Belt region is one that is provided with context. So I'll stop there.
All right. So let me just say this. I don't know if anyone else does this, but when I'm like listening to podcasts or I'm hearing information and I've got my earbuds in and I'm walking or I'm doing stuff around the house, I start talking back to the podcaster, right? So as Veronica was talking, I was like, yep, that's right. I was like, oh, you're the moderator. People can hear you. So I'm sorry for interjecting, but those things just so resonate with me, with the work that we're doing, coupled with everything that Sara set us up with. But before I move on, Veronica, I want to stay with you for just a moment. What's important, I don't want to make any assumptions here, and I'd like for you to talk about the Black Belt region. I want to make sure everyone who's listening today understands exactly what that means. And if you could just take a few moments and really just describe the area and how it got its name and why this is a unique environment to some of the other rural areas that we might think of, as you mentioned, in Appalachia, et cetera. So just educate us for a moment, please.
Sure. So the Black Belt region is a geographic region that extends from eastern Texas to the eastern shores of Virginia, often considered the plantation South. So this region was built on agriculture. Booker T. Washington and Du Bois spoke about the Black Belt, the richness of the soil, the Black bodies that were brought to actually work that soil. So there's a tradition of agriculture in the region. And this tradition is also coupled with a very unique political culture. So traditionally, these communities also have had a very hierarchically structured decision-making infrastructure that still impacts those communities today, right? The lack of opportunity to participate politically by many African Americans in those communities have helped to shape this country. So when we think about the civil rights movement and all of the major points of action, they were Black Belt counties. So these counties have a very high percentage of African American population, even to this day. Some of those counties have up to 70% African American population. We also have many of our persistent poverty counties within the country reside in this region. Many of our least educated counties, as they are often called, reside in this region. So while I like to start off talking about my experiences growing up in the region, the richness of the food, the people, the land, all of those wonderful things, this region also has significant challenges. And that is, directly tied to child hunger.
That's
and
right.
the need for us to have this conversation today.
Thank you for that. So this year, our theme, as you all may know, but let me repeat it, reboot, reconnect, and redesign, creating equitable solutions for rural children. Yesterday, Secretary Vilsack and Secretary Cardona discussed how important pursuing comprehensive approaches to advancing equity for all is to the Biden-Harris administration. And Sara, I'd like to come back to you. Tell us a little bit more about your role as the first Director of Nutrition and Nutrition Security and Health Equity for the Food and Nutrition Service. What does this mean for rural communities around the country?
Sure. First off, it is definitely an honor to serve in this role at FNS, the Food Nutrition Service. And I hope you heard the Secretary's passion yesterday, but he is very committed to tackling food, nutrition, insecurity, and wanted to create a position that could be dedicated to advance his goals in this space. And at the same time, help leverage all of the department's equities to promote and elevate nutrition security. The Secretary also saw ending the pandemic as critical to the goals in food, nutrition, security. And so I spent the first year of the Biden-Harris administration helping the Secretary on COVID-19, and then started just this past January with this nutrition security hat on. So I have the opportunity to work closely with the Secretary and Deputy Undersecretary for the Food, Nutrition, and Consumer Services, Stacey Dean. You heard from both of them yesterday. Mm-hmm. I also get to work closely with FNS Administrator Cindy Long and the Senior Advisor in the Office of the Secretary on Nutrition, which is Kumar Chandran, among other advisors, and also my assistant, Sheila Fleischhacker. All of our work focuses on developing and executing a whole of government approach to promoting and elevating nutrition security. And frankly, one of the best things about USDA is the passion of our staff. This is my second tour of duty with the department, and I honestly love it. And every day I'm so grateful for colleagues at the department and also our vast network of partners, and that certainly includes Share Our Strength. Now, I mentioned that I focus a lot on lifting up USDA's key equities and what we bring to bear that makes us as a federal department uniquely qualified to lead on nutrition security. And there are really four that I want to mention to this audience. The first is our nutrition assistance programs. So those reach tens of millions of Americans, which includes more than 30 million school children each day, nearly half of all infants in the US, and this is at about 99,000 schools. Our second key equity is our nutrition education and promotion efforts. Those total more than $1 billion per year across all of our programs. The largest is SNAP education and WIC nutrition counseling, but we also do a lot of education through Team Nutrition, which supports the child nutrition programs. The third key equity is the translation of the dietary guidelines for Americans through MyPlate. Some of you may have seen that we launched the 2025-2030 edition of the Dietary Guidelines for Americans a few weeks ago by posting the scientific questions for public comment. And then the fourth equity that I want to make sure you all have on your radar is all the other complementary activities happening across the department. So one example is the Gus Schumacher Nutrition Incentive Program. This is formerly called FINI, helps families purchase fresh fruit and vegetables. And the other is the Expanded Food Nutrition Education Program, which is actually the nation's first education program for low-income populations. Now, to guide us toward nutrition security, we've identified 4 pillars. The first is providing meaningful support from pregnancy to birth and beyond. The second is connecting all Americans with healthy, safe, and affordable food sources. The third is developing, translating, and enacting nutrition science through partnership. And the fourth one, and perhaps the most important, is prioritizing equity every step of the way. And one thing that I do want to emphasize is that all of this work that we're doing is driven by research and grounded in science. And it's woven into our policies, it informs each of our decisions. And most importantly, it impacts every life we touch. And one of the things that I constantly think about is I'm a baby of these programs. And I said it once, but I'm a SNAP baby and a WIC baby and a school meal baby. And these programs touch individual people, and it matters to individual people, and they can be a huge lifeline for families. And that was totally the case during the pandemic. So it's just really an opportunity, and it's exciting to work in this space at a time when, from the president on down, there was such a strong interest in not just promoting nutrition security, but also in promoting racial equity.
Thank you for that, Sarah. In fact, I started this conversation by acknowledging the brilliance of these two women. And when you get such a thorough answer and you look down at your paper and you're like, oh, well, the next two questions I don't need to ask because she's covered those already. So I want to come back to Veronica for just a moment. You started the Black Farmers Network. Can you give us a little bit of history on why you knew that was needed? And what is the future of farming going to look like?
Okay. Thank you for that question. I started focusing on African-American farmers through my research with the Black Belt region. And I found the important role that they've always played in the region and in this country. So often we think about African-Americans in the rural South as arriving here as empty vessels. And what we find is that they came with extreme agricultural knowledge that was used to build this agricultural economy of the South. And so African-American farmers have played a role since the very beginning of our country, and they became the leaders of the Black Belt. When we think about the people who owned the land, those were Black farmers who then used that land to build strong African-American communities. They volunteered to give their land for churches, to build our churches, to build our schools. They were often economically independent people within our community, so they could speak up, and they were often targets. So it was African-American farmers that even during the 1960s provided land for tent cities when people were being forced off of the plantation. So the struggles of African-Americans can be seen in the journey of African-American farmers in their fight, against systemic racism, against the lack of access and opportunity. And so I really got involved in looking at their journey. From that, I wanted to do some research on their experiences with the USDA. And after meeting many of those farmers and hearing their stories, I found a couple of troubling things. The first thing was that many of them were older. And so I saw where we needed to do a better job of reaching younger people to show them that this was a viable option for the future. But if the only stories that they've heard about being an African-American farmer were negative stories, then of course, who wants to be drawn into that narrative, right? So the Black Farmers Network was a way to share the story of African-American farmers, to show the diversity of farmers that we have, but also show that this is a viable, future for young people in their community. One of the things that I found was that they really didn't have a presence online. And so the Black Farmers Network was a way for me to disseminate my research. Oftentimes in the academy, we're focused on sharing information with other academics. And I am firmly committed to sharing research that I do with the community and the broader community. And so the Black Farmers Network was a way for me to do that, to be able to share the research that was being done, but more importantly, to share and spotlight African-American farmers. African-American farmers are not only an important part of our social history, but also our economic history, present and future. If you have land, that can be manifested into generational wealth and can be, transmitted from one generation to the next. But if young people run from that occupation, then we have an issue. And so the Black Farmers Network was created to tackle many of those challenges that we find ourselves, within this region.
Thank you for that. And just, yes, the idea of land and how it does create wealth. And there's so much history for Black people in land and farming. So I appreciate you sharing that with us. Sara, let me ask you to go a little bit deeper in where you were just talking. The USDA has recently prioritized nutrition security, and I know you've covered some of this, but can you tell us a little bit about what nutrition security means and why the USDA has made this one of their key focus areas?
Yeah, appreciate the question. I should have led with the definition, but before I jump in there, I do just want to thank Veronica for sharing her insights. My grandfather was actually a corn farmer in Maryland, and it's always painful to think about the barriers that he and so many like him faced. I have great memories of sitting in the back of his truck and trying to grab crab apples off trees as he was like going through the fields. But I also have memories of him going to the Safeway, which is a big grocery store in Maryland, and trying to sell corn and the prices that he was receiving versus white farmers. So it's great, Veronica, the work that you're doing.
Thank you, Sara. Thank you.
And I do want to say that switching back now.
We need you. We need your voice.
And I should say, actually, it's funny where inspiration comes from. So my grandfather, the corn farmer grandpa, he couldn't read and write very well. And so when I got into Harvard, it was a huge deal for him, huge.
Yes.
And I remember I was living in LA and I drove from LA to Maryland. I'm from inner city Baltimore, but he lived in Maryland and that's up in like the rural area. And I went by to see him on my way to Boston. He never talked a lot when I was a child, but he pulled me aside and he said, Sara, he said, don't you go up there and get uppity. And I remember it was like in one ear and out the other. I was like, yeah, grandpa, whatever. And then I got up there and it was hard. And I'd never really struggled in school before. And his words came back to me. And it just, when I was trying to pick a topic to focus on, I was working on a lot of things that were hard to understand. But I thought, in the end, I settled on sort of food nutrition policy and obesity policy, which is where I've been for a couple of decades. And but his words always came back to me because there's not a person that I can meet now on a plane, on a train, on a bus, who can't talk to me about what it means to be hungry, who can't talk to me about what it means to struggle with your weight, or to not have a diet they think is adequate. So very affirming that I always ask myself when I explain things, would my grandfather understand what I'm saying? And if he wouldn't, then I need to reframe it and say it in a way that someone like him, who has all this lived experience, but not a whole lot of book smarts, can appreciate what I'm trying to say.
Exactly.
That's right.
But do want to say, so trying in an effort to answer your question, I say that I have really been, and I said this once, but it's worth repeating, the effort that is coming out of USDA around nutrition security is genuine. And even before we get there, I also want to say that when it comes to farmers, the secretary and the department are really making an effort to address our past and pave the way for a better future. And a big piece of that is thinking about the president's executive order on advancing racial equity and all these other efforts that we're doing to promote and elevate nutrition security. So let me just take a moment and say what that actually means, which is having consistent and equitable access to healthy, safe, and affordable food. A question we get a lot is, well, how does nutrition security differ from food insecurity? So the important message for this audience is that nutrition security, it builds on and it complements food security, but it's different in two key ways. The first is that it recognizes that we are not all maintaining an active, healthy life. And the second is that it emphasizes taking an equity lens to our efforts. Now, I briefly mentioned structural racism at the top, but do just want to say that we really can't and shouldn't talk about equity without considering the context in which we live. And what that means is that we should be thinking about structural racism in the context of child hunger. And structural racism is not just the result of an individual holding prejudices, but it's also produced and reproduced by laws and rules and practices that in some cases are even implemented by government and sort of embedded in the societies in which we live. So as we think about structural racism, I think we have to recognize that it's real. It reaches back to the beginnings of US history, and it stretches across our institutions and economy. And it harms health in ways that can be described, that can be measured, and that can be dismantled. And this is where nutrition security comes in, and where we at USDA and all of you who do work in this space are really trying to make a difference.
Yeah, Sara, it's, so interesting. Like I said, COVID revealed so many things for us as a nation, as an organization, just even as individuals. And the concept of connecting systemic racism to poverty, to hunger, is now allowed to be mentioned in the same sentence in a way that it had not been before. So I'm so grateful to hear you talk about what USDA is intentionally doing to make sure the connectivity, the root causes, the trajectory of where we are is being looked at in a very holistic way. I find that to be part of the solution to what we're trying to do. We can't just focus on one piece of childhood hunger and not think about, childhood obesity, adult obesity. And then the next thing you know, we're talking about diet-related diseases. All of these things are so interconnected. And it's really encouraging that the fulsome of the topic, the fulsome of the history, the fulsome of the environment in which everyone lives is all coming together. So with that, I'd like to go back to a little bit of what you've already been sharing with us, but let's keep going with this for a moment, if you don't mind. So can you explain some of the specific actions USDA is taking to promote nutrition security? And I do want to say, I appreciate you giving the definition. People on my team hear me say this all the time: words and definitions matter, right? So the definition of food and nutrition security, but can you talk a little bit more about how that's showing up in rural areas?
Yep. So great question. And this is the part that gets me jazzed up, because this is not lip service. There is a whole lot going on that is intended to make a meaningful difference. So let me talk generally, and then we'll be specific to several examples in rural areas. So first, just want to say that we have a lot of ongoing work that is intended to advance nutrition security, hopefully in a meaningful way for tens of millions of Americans. So just to list a few. So last fall, we did a historic update to what's called the Thrifty Food Plan. That forms the basis of the SNAP benefit. And what that did is it increased the purchasing power of people who were on SNAP by 21%. That was significant, extremely so. It was the largest increase in over 4 decades. And the key is that it is putting healthy food within reach. What's happening now is that we're issuing updates for Alaska and Hawaii. We are also updating the WIC food package with science-informed changes. We are updating school meal standards. As I mentioned, we are initiating the next edition of the Dietary Guidelines for Americans. We are launching tribally led nutrition initiatives, and we've restructured the SNAP education portion of the SNAP program, which includes creating a new nutrition education branch to support SNAP Ed and also improving data collection. We're also excited about the FY23 budget. So President Biden's budget has transformational investments that are really going to bolster access to healthy and affordable food for families and build on our far-reaching nutrition programs. It is hard to overemphasize how important our core nutrition programs are. So SNAP, for example, provides nutrition assistance for more than 43 million Americans. WIC improves health for infants and children with an average of about 6.5 million low-income women, infants, and children. And those budgets are continuing in the president's budget for FY23, as well as the provision of the enhanced cash value benefit. That's for women and children on WIC to get additional fruits and vegetables. And it's a very popular benefit that's available right now. I'm also excited because nutrition security has its own budget line in the president's budget for FY23, and that's $23 million, which are intended to really promote and elevate the work. And what the funds aim to do is to build and broaden the capacity of the food nutrition service to deliver effective nutrition education and promotion to all Americans within our existing program structures. So across the suite in the food nutrition service, we have 15 different programs that we're using to bring food to families. So what are some specific examples that we're doing in the rural and tribal space? So one key one is online ordering. So if you live in a food desert, which often includes rural communities, you may have limited access to affordable and nutritious food. So online ordering then becomes a way to help expand access to healthy food for these individuals. It also, frankly, helps break down barriers for those who are concerned about stigma at the point of purchase. So shopping with a SNAP card and wondering what people are thinking of them as they do that. So as of March, SNAP, which again, formerly food stamps, those benefits can be used online in 49 states and the District of Columbia. And we're continuing to work closely with our partners to add the final state and then more retailers to increase convenience. And I want to emphasize that at the start of the pandemic, it was only a handful of states that were in this program. But given the concerns around in-store shopping and COVID transmission, as well as big issues around accessibility and stocking shortages, the online portion of SNAP started going up incredibly fast. And this is a really important resource for those in rural areas. The second is that we introduced a new grant program. This is the Emergency Food Assistance Program Reach and Resilience Grants. And these are helping to expand the program into rural, remote, tribal, and low-income areas that have historically been underserved. And the third that I really want to emphasize is the Indigenous Food Sovereignty Initiative. That was recently launched by the Office of Tribal Relations at USDA, and it promotes traditional foodways, it promotes Indian country food and agricultural markets, and Indigenous health through foods that are tailored to American Indian and Alaska Native dietary needs.
Somehow I muted I muted myself because I kept talking back to the to the two of you as you were talking. I was like, let me just mute myself so I can just preach and listen quietly. The entirety of what's happening at the federal government level is so important. And it's telling us that what we didn't think we could do before, using the example with online ordering, that was rolling out in states, a couple at a time. And the next thing we know, like, this is needed. It's helping people. And it's just, like I said, so encouraging to hear all of these things that Food Nutrition Services and the USDA are doing with Secretary Vilsack's commitment to equity is really evident. I want to, this is a little bit off script, but I think it's very relevant. You mentioned Indigenous populations, and oftentimes we don't talk about the impact Indigenous populations experience, and we don't think about how much of the land is rural for Indigenous populations. So I'm going to toss this to the both of you, but Veronica, if you want to get us started with that, and then Sara, I'll come back to you. I'd love to hear a little bit more about that.
Well, in terms of the Black Belt region, we still, of course, have populations of Indigenous and Native people still in the Black Belt region as well as an emerging Hispanic Latino community, particularly those that are drawn to agriculture. So when we think about food insecurity, when we think about the lack of basic infrastructure in communities, people of color, it impacts all people, including white populations as well. I wanted to speak just a little bit about the pandemic and what it revealed. Many of the issues that we're speaking of today, people have been speaking about these issues many years. I think the COVID pandemic has been horrible, as all of us know, but it has provided us an opportunity to address issues that we have not addressed. So in terms of issues with Indigenous people, Black Belt people, people in Appalachia, all around the community, all around this nation, those issues were always there. So when you say we've got to push everybody online because of the pandemic, when you look at tribal nations, when you look at the Black Belt, you look at rural communities, places that did not have high-speed internet, something that we've been screaming about, we now have to address those in real time. The weak local food systems of Native people, of people in the Black Belt, of people in Appalachia, the areas of this country that we have underutilized and underdeveloped, and have had, significant child hunger for many, many generations. COVID revealed that urgency in these spaces that I think we had forgotten. The inadequate healthcare, systems in indigenous nations and the Black Belt, Appalachia, these pockets of persistent poverty that we've had in this country for many, many generations, the lack of trust in medicine and the medical community. I think all of these things, I wrote down as Sara was speaking, the history is present. And so regardless of what peoples we happen to be talking about, those experiences that have happened historically are resonating today. And I want us to be the generation to deal with it. And I think that we really can, but we have to be intentional about our approach.
That's right. That's right. So I'm going to take an editorial moment here. Y'all, the tweet is the history is present. That's the tweet.
The history is present. The history is present.
That's it. That's it.
Mm-hmm.
Sara, I want to give you a moment to respond to that as well. And then we'll go on to our last. I looked at my watch. I was like, oh goodness, we're about 15 minutes left. So I want to make sure I get to everything and then close us out appropriately here.
Yep. So I want to hit on 4 points quickly. One is just to build on what Veronica said. Trust issues are real. And it is not an accident that many tribal communities don't trust the federal government. What I can say is that there are very dedicated efforts at USDA through the Office of Tribal Relations and throughout the department to really try to put programs in place to build the trust, to do the types of engagement that will make communities realize that we are serious about trying to be helpful and we're serious about tribal health. The other issue is data is a real concern and what we actually know about tribal communities. So generally, what the evidence suggests is that tribal communities, their rates of food insecurity are about 3 times higher than white Americans. So that right there gives us a lot of pause. But the data vehicles that we have that are traditionally collected at the national level don't have great representation of Native populations, and that's an issue. The third thing I would say is the commitment of USDA, the commitment of the federal government around tribal communities from where I sit feels very real. There's a lot of work that's happening to lean in, to not just talk at people, but to have two-way conversations about what makes sense and how do we need to modify things to fit within a space that is going to work for tribal communities. And then the last point I'd make is just to circle back to Veronica's point on broadband. I think the shocking thing about USDA is it does just about everything. It does electricity, it does farming, it does food, it does fire. We do so much, and we also do rural broadband. And so that's an area where we've done a lot of investing. There is additional dollars in the FY23 budget in that specific lane. And so it is not solved, but it is definitely something that we recognize, because if we want telehealth to work, if we want Snap Online to work, if we want WIC Online to work, which is going to be rolling out, people have to be able to access the internet. And USDA is very concerned with the ability to do that in rural populations.
That's great. That's great. And it's interesting that we're talking about things related to nutrition security that I don't think folks really connected some years ago. So this, like I said, the richness of this, I'm really appreciating. I want to have one last question to you, Sara, on some of the investments, and you've been talking about this, but some of the investments that USDA is making in rural America. And can you describe what the intersections with nutrition security might be?
Yeah, so one thing that you often hear the secretary say is that when rural communities thrive, America thrives. And so we very much take that seriously as we think about the work we're doing around bolstering nutrition security. So just to give you a couple of examples, we are partnering with states to issue summer electronic benefit transfer benefits to support eligible families in rural areas that have limited access to more traditional summer meal programs. We're also looking at the lessons learned from the Emergency Meals to You program to see what we can apply to future efforts as we think about trying to get much needed food to kids in extreme remote areas. We are working to increase equity throughout WIC. So lots of things we're doing around program modernization that are going to help us serve moms and kids that are eligible, including those in rural areas. And we're also aiming to build on the expansion of SNAP Online with focus on smaller independent grocery stores that will help us make more inroads in either food deserts or also rural and remote areas, which in many cases do include food deserts, excuse me. The other thing I would say is that we know that we cannot do this alone. And so while we are dedicating tens of billions of dollars to our nutrition assistance programs, we are really relying on partners to give us feedback. Hunger is a really complex problem. And to Pamela's point, it is not going to be solved by the nutrition assistance programs. And it is not going to be solved solely by important research. It is going to be solved when we put sort of the weight of all of our assets toward it so we can shift how things are now. And so that's where I think we have to be clear about, here's USDA's lane, here are other lanes. How can we in complementary ways push this forward as we all work toward the same North Star?
That's right. That's right. Thank you for that. So we are coming close to the end of our time, and you all have given us so much information today. I feel like, you know, I've been educated. Veronica, I feel like I sat in your classroom for a little bit, you know, and Sara has shared with us some of the great investments and recognitions that the USDA has made in this area of work. Before we close out our conversation, and I know this is probably the most loaded question I can ask, but I'm going to go ahead and do it anyway. Is there anything that I didn't ask that you are like, Pamela needs to know this, the folks listening to this conversation need to know this before we close? So I'm going to make this a little bit of like, just freestyle it, y'all. Tell us what we need to know. So Veronica, I want to start with you.
Okay. The first thing that I would just like to say, thank you again for this opportunity. I would like for us to make sure that we lead by inclusion. And so wherever you are, whatever role you're playing, whatever community efforts you're doing, make sure that those are inclusive of our community experts. Oftentimes in various capacities as leaders, we typically leave out the people that are most impacted by our decisions. And so one of the things that I would like for people to take away from this is who best knows about these programs and the impact than those who are being served. So make sure that whatever we do, that we include the community in our discussions and in our decision-making so that we create policy that is actually reflective of the experiences of the people in which, you know, these policies will be impacted. I also would like to just say that I'd like for everyone to see food as a basic human right. We're in one of the richest countries in the world, and to have children who are hungry, I know that we can do better than that. So just working together, making sure that we're inclusive, making sure that the community is a part of our decision-making. That's what I would like for people to take away from that. And that those of us that have been fortunate enough to go into spaces of the academy or government, that we always partner with community.
Thank you. Yes. Veronica's given us all the tweets. Food is a right. Food is a basic right. Sara, the floor is yours, my friend.
Yeah, so two thoughts I would leave y'all with. The first is now is the time. And you get these windows of opportunity to try to really advance things that you care about. But this is a time to lean in on nutrition security because we know that food insecurity is high. We know that diet-related diseases are high. We know that diet-related diseases are rising due to the pandemic, and they disproportionately impact historically underserved populations. In this moment, we have the attention, we have the budgetary commitments of the federal government to make progress in this area, and we need to all take advantage of it. And the second point is one I already made, but I want to foot stomp on it, which is USDA alone, despite the fact that it is investing significant resources, cannot solve the problem of diet-related diseases and disparities. So we need partners like Share Our Strength, No Kid Hungry campaign, and all of you who are coming from different organizations to help us advance this effort.
Fantastic. So Sarah put out a tweet for us too. Now is the time, right? I love to hear that this is not one organization, one federal agency, one university, one person's problem to figure out how to solve. Everybody has a role to play in this. And I'm just going to go ahead and make a shameless plug for Share Our Strength. We always say everyone has a strength to share. So that is a perfect way for me to bring us to our last question for this session. Please share some key things members of our audience can do right now to help rural communities reboot, reconnect, and redesign. I'll start with Veronica, please.
Well, I just continue my theme of inclusion. One of the things that I often tell people is that when you're in your room, in the room of decision making, look around the room. Are you comfortable with everyone that's there? And if your answer is yes, then you need to expand the circle.
Yeah.
That is very, very important, is making sure that the work that we're doing is actually reflective of the problem. And that we may have to, this theme of reboot, redesign, in the Black Belt in particular, we're very focused on tradition, which is very important. But in order to redesign, we've got to get out of doing things the same way, talking to the same people, and having decisions from the same small group of people. So I would just encourage people to move beyond the tradition in terms of moving their communities forward and really, really be inclusive about the decisions that you're making, and to involve young people. I know you had a session yesterday about involving young folk and making sure that they are a part of this work. And that is very, very important as well. Invest in our future people.
That's right. That's right. Thank you. Sarah, to you, please.
Veronica stole my thoughts, and so I was also going to say it's so important to engage with youth. In fact, next week we're having a community conversation about promoting healthy eating to support the president's cancer moonshot. And so we have a woman, Kate McGale. She served as the college liaison at a recent national 4-H conference. So she's going to join me and others to share the high school perspective about what we at USDA can do to promote nutrition security. The other thing I would say, and this goes back to Veronica's point about tradition, pride is a reason that many people choose to not take advantage of nutrition assistance programs. So 1 in 2 people eligible for WIC do not participate. 1 in 5 people eligible for SNAP do not participate. There's a lot of efforts going on right now to change those numbers, but at the end of the day, sometimes you need to hear from family and friends that it's okay to accept benefits. So I would say if you know someone who could benefit from USDA's programs and they're not enrolled, encourage them to take advantage of them. I do also, if you'll permit me, I love Maya Angelou, and I would just love to leave you all with a quote that really inspires me, which is, "We delight in the beauty of the butterfly, but rarely admit the changes it has gone through to achieve that beauty." And so today, I'm the product of slavery. I'm a recipient of SNAP and WIC, and I'm delighted to honor USDA's work to promote nutrition security and health equity, recognizing that while we are doing a lot, we have so much more to do. And so I hope that we can all do all that work together.
Well, if there was ever a more perfect close, I don't believe I've heard it. So thank you, Sarah, for that. And I want to thank everyone who's been listening. Thank you for your time, not only today, but yesterday, participating in the summit with us, hearing all of the information we have to share. I certainly hope you'll stay with us throughout the rest of the, almost morning and afternoon, for some continued conversations. This has been a wonderful hour, and I cannot be more thankful and grateful to Sara Bleich and Veronica Womack for sharing their stories, their personal backgrounds, their intellect, their hard work, their journey of why this is so important to them personally, but what they're trying to do to make sure every child has the nutrition that they need to thrive. So with that, I will close out this session. Wish you all a wonderful, wonderful day, and we will see you on the next session.
Thank you. Thank you.